Okay, we're live.
Okay, hello everyone. I'm Dr. Stephen Chagares. Welcome to Tracy's BRCA Strong page. We appreciate your coming on. I have with me today Dr. Antonio Toesca from Italy, who flew in to be with me for the first robotic mastectomy, which we performed today.
Hi, good evening to everybody. Welcome. And today, Dr. Chagares gave a of him. Absolutely.
Appreciate that.
Can you describe this new event, this new operation?
Yes. So, as people are logging on, we'll talk about what happened today. We initially got together when I found out about robotic mastectomy through journals, surgical journals, and Dr. Toesca invited me to fly out to Italy to learn the procedure of robotic nipple-sparing mastectomy, and then came back, and now we had our first bilateral robotic nipple-sparing mastectomy. Today, bilateral means both sides, and everything went fantastically. It went great. The patient's extremely happy, the family's happy, and everything went fantastically.
Yeah, it is.
So, Dr. Toesca's procedure is unbelievable. It was fantastic to learn under him and then have him with me today in the OR and being there. It was fantastic.
What about the future of robotic mastectomy?
Well, I think that we are moving into a new realm indeed where...
I agree.
Yes, definitely. This is going to be, for the patients who can have nipple and areolar sparing mastectomy, this is going to be a fantastic movement into the future.
Absolutely. It's sort of conservative surgery for people that need to undergo to a operation that is not conservative.
Yes.
So this is a revolutionary vision of this kind of operation.
Definitely.
Yeah, congratulations.
Well, thank you. And for those who don't know, Dr. Toesca pioneered this procedure in 2014, so it's been 4 years now. He's done almost 100 of them, I think, right?
Yeah,
close to that,
around,
or if not
around,
over.
yeah.
And everything's been going fantastically there, and hence we brought it here to the United States, and we're actively performing consults and bringing patients to the OR to do the procedure here.
It's a good opportunity for patients for BRCA mutation or also for disease patient.
Right.
Absolutely.
Definitely. And the fact that we can have a mastectomy and have no scars on the breast,
Yes.
and just a 1-inch incision.
Hidden incision, yeah.
It's fantastic.
Fantastic.
That was
Yeah.
great vision on your part, and I appreciate your teaching and bringing it and spreading it around the world.
Yes. Great.
For anyone who wants more information, we're at roboticmastectomy.info. That's all the information on robotic mastectomy. Be happy to share everything with you. What else can we tell you? Things went so nicely today that it was kind of... Well, I have a question. What was it like seeing your procedure done, not by you, but by someone else who you mentored?
Well, I feel very proud of this. Today I was watching you doing this very good performance, and I was proud of being there with you in United States. And how can I say, this is a very good step forward for me, for the surgery, for medicine, for the patient.
Yes, definitely.
Yeah,
so,
definitely.
That's fantastic. I can imagine how that must make you feel really proud.
Yeah.
And it's true, you're the one getting it spread all over the world so that women don't have to have scars on the breasts. That's unbelievable.
Yes.
We have a event coming up next week that BRCA Strong is hosting in New York City, and we are going to be having a symposium talking about the robotic mastectomy procedure and the future of robotic mastectomy. That's really exciting, next Friday night in Manhattan. So anyone who can get there and join us, that would be fantastic. Let's see, what else can we say? This is just such an exciting day. We've been building up to this day for a few months now, and to be able to get to this point. And for anyone who's out there in South Carolina or North Carolina having the storm that's going on right now, Florence, our hearts are with you, and I hope that you all are safe. We're kind of glad it didn't hit up here, because I don't know how I would have done this had the hurricane hit up here. Not that we ever wish anything on anyone, but we were glad to have some good weather for Dr. Toesca to fly in last night. What about your side? Italy, how's that doing? Are more people doing it there?
Yes, absolutely. More people are doing there. In this moment, we are also conducting a scientific study, a randomized study comparing the classical technique to the robotic technique to demonstrate the higher satisfaction of the patient. And results are pretty coming, and we are very, very happy about that. And so it's a very big bet, really.
That's fantastic.
And it's working.
Where else have you been in the world with other people, or what other countries have come to see you?
So yes, many countries in the world came in Italy, in Milan, to European Institute of Oncology to have a look of this technique. And after that, they started in New Delhi, where the medicine, it's very advanced, and they started also in Paris, and now in US. So congratulations.
I'm glad to extend it out.
Yeah, absolutely.
Yes, as you know, I actually had a patient contact Dr. Toesca when we initially posted about going out to Italy. Unfortunately, she wasn't a candidate for this. But the word gets around, and it's getting around the world, and I think more and more women are seeing that there really is another option out there. There's a lot of the psychosocial side of the surgery.
Absolutely.
And for someone to be able to wake up and look down and see what they see every other day.
Absolutely. Also because this kind of technique guarantee some like one-step reconstruction. So you can go out from the operative room with your final reconstruction, which is very important in this moment. Absolutely.
Yes, there's a lot of patients who, when they have the open procedure, need multiple steps to finally get to the point of having the final reconstruction. And that is a great other point. It cuts a lot of other steps out for the women who are already in the middle of some pretty psychologically difficult areas, and many times physically, especially if they had cancer.
Yeah.
So we're just really proud to be able to offer this. I'm really proud to be able to offer it in the United States. I'm really proud of Dr. Toesca. And the fact that Tracy was able to help us and get together and get the BRCA Strong group out. We really appreciate that too, because we have to get the word out so that more people know that this is an option.
Absolutely. This is an option for all kind of patient who wants to do this.
Yes, so as we said, we have an active program. We are seeing patients, booking them for surgery, and getting robotic nipple-sparing mastectomy done here in the United States. Again, Dr. Chagares is my name. The website is drchagares.com, and the information for this is at roboticmastectomy.info.
Thank you very much.
Thank you too. We appreciate everyone being here tonight. Have a great night and be well.
Thank you.